Hello and welcome. You're watching FYI. For your information, I'm Gargi Rawat, and today we're focusing on air pollution and the impact that it has on us and on children. Two very alarming studies have emerged recently that show us the devastating and long-term impact air pollution is having on our health and on our life expectancy. Now, the first study, led by NGOs Lung Care Foundation and Pulmocare Research and Education Foundation, compares the respiratory health of adolescent school children in Delhi with those who are studying in relatively cleaner cities in terms of particulate matter air pollution. Now, according to the study, there's a direct link between air pollution, obesity and asthma after the comparative study between children in Delhi and children living in cleaner cities like Kottayam in Kerala and Mysuru. Now, it found that the prevalence rates of cough, shortness of breath, chest pain, tightness, blocked nose, sneezing, itchy, watery eyes and eczema were reported to be significantly higher in children living in Delhi. It also found that children living in Delhi were more likely to be overweight or obese and that their conditions were strongly associated with airflow obstruction and asthma. So that is the first study on children that has found these startling findings or facts linking air pollution to obesity and asthma. The second study, it's a report by the Energy Policy Institute at the University of Chicago, which says that North India breathes pollution levels that are 10 times worse than those found anywhere else in the world, and that air pollution can reduce the life expectancy of Indians by 9 years. The study says 480 million people in northern India face the most extreme levels of air pollution anywhere in the world. And over time, these high levels have expanded to cover other parts as well. So it's covering the entire North India, more or less. It also says strong, clean air policies can add up to 5 years to people's lives. Well, to talk about this air emergency, we're now joined by Dr. Arvind Kumar, a founder trustee, Lung Care Foundation chairman, Institute of Chest Surgery, Medanta Hospital, someone who was involved in that first study which compares children in Delhi with those in Mysuru and Kottayam. Dr. Vikas Oswal, consultant chest physician, national NDTV trainer, joining us from Mumbai. Siddharth Vermani, executive director, Energy Policy Institute at the University of Chicago's India team, and Bhavreen Kandhari, mother and member of the warrior moms who've been, protesting and campaigning for cleaner air for their children. Now, Siddharth Vermani, I'd like to start with you. Tell us more about how you came to these findings, these startling findings that life expectancy is being cut by nearly 9 years due to air pollution, and also that high levels of air pollution are expanding geographically.
Yeah, thank you, Gargi. I would just like to introduce that the Air Quality Life Index, or AQLI as we call it, is a very unique way of measuring as well as communicating the health risks of air pollution. So what we basically do is convert air pollution concentration into the most important metric, which has personal consequence for us, and that is its impact on our life expectancy. So it's based on very rigorous research that confirms that there is a relationship between exposure to air pollution and life expectancy. And so you have very well summarized some of the issues, which have emerged from this particular report. And I mean, one of the most startling facts today is that all of India lives in areas where the average air pollution level exceeds the WHO guideline. In fact, nearly 40% of India's population is exposed to air pollution levels which are not seen in any other country. So, yeah, I mean, these are some of the very startling findings, aside from the findings that you have already summarized very well.
Right. Dr. Kumar, let's talk about your study now and, this link between obesity and air pollution. If you could tell us a bit more about that. And, it's quite startling to see, what a difference it makes for children who are living in cleaner cities in the south, that is, in Mysuru and Kottayam, and then the children living in Delhi and how they're, facing more issues like asthma, more allergies, more, itchiness and coughing, sneezing, and of course, and this obesity that has been found.
So, Gargi, first of all, thank you very much to NDTV for including both these studies and dedicating this special program to these two studies, which I think have huge significance for the entire country and its providence that both these studies were released on 1st of September. what our study has shown is the beginning of the damage, and what EPIC study has shown is actually the end result of the same damage. We had been knowing for quite some time that air pollution adversely affects health. So we hypothesized that children who are living in polluted cities will have their lung function, which will be worse than the children living in less polluted cities. So with that hypothesis, we took about 1,000 odd children from schools in Delhi and compared their lung function with the lung function of children who were born and brought up in Kottayam and Mysuru, which was our control sample. Now, the unique thing about this study is that we normally, all studies look at questionnaire-based diagnosis of airflow obstruction. In this study, we took the state-of-the-art spirometer to all the sites and did on-site spirometry, which is world's best measurement for doing the lung function study. And what we found was very, very shocking. As you have yourself mentioned, more than 50% of the children in Delhi were sneezing most of the time. When we looked at shortness of breath and cough, which are two very important symptoms of respiratory problem, it was present in about 30 to 35% cases. Itchy red eye, yes, your graph shows it. You can see the first one is sneezing, second is itchy watery eyes, then the cough and the itchy rash, shortness of breath and tightness in the chest and eczema. All these were very, very high on questionnaire. Most shockingly, when we, and please keep this graphic, the previous graphic, if you can go back to, when we did their on-site spirometry, we were amazed, and this is a very, very significant finding. 29.3% children in the city of Delhi were found to have spirometry-proved airflow obstruction, which is synonymous with asthma. And when we broke it into girls versus boys, 37% boys and 19.9, that is 20% girl. Gargi, this is a shocking figure, which means that 1 out of 3 children in Delhi are suffering from spirometry-proved asthma. Another important aspect was that majority of these children were not aware that they have asthma, and hardly anybody was on treatment. More shockingly, it was a very unexpected finding. We found 39% children in Delhi to be having obesity or overweight. And when we tried to link obesity, overweight to asthma, we found a very high odds ratio of obese.
Absolutely. I mean, all these findings very, very startling. And Dr. Vikas Oswal, talking about comparing children in different cities, the study by the University of Chicago also talks about spreading air pollution and how it's, spread across Maharashtra, Madhya Pradesh as well. Concerns about that. If you could tell us what's being done there.
Right now, I am very happy, at least, compared to Delhi, Mumbai is doing better, I would say, at least in the form of figures and the pollution. Right now, if you see PM 2.5, that is air quality index, which we, these fine particulate matter, how exactly they correlate is, they are the air pollutants, which are, if they are on the higher levels, they lead to reduced visibility and cause air haziness and health-related issues, respiratory issues. So luckily, there are categories of, if they are between 0 to 15, they are at the good level, you say. And if they are 51 to 100, there is an index of 51 to 100, it is moderate, and more than 100 or to 150, it is basically an unhealthy air which we are breathing in. And that's what is happening in Delhi right now. If you see the AQI of Delhi, it is 158 at the current given point of time compared to Mumbai, which is hardly around 49. And I am happy today. Breathe in air in Mumbai is much better right now compared to Delhi right now.
Well, Mumbai has the advantage of being next to the sea as well, but a lot more, needs to be done there to reduce the air pollution. Bhavreen, I know you and your group have been, campaigning for several years now. Awareness about this has really grown in Delhi, but, year after year, and we're going to go into the colder months now, and again, it's going to become this real crisis situation, and every year, more groups are formed to find out how we can solve the air crisis.
Yes, Gargi, yes. I would call myself, a desperate mother and desperate mothers because, these studies are here. Dr. Arvind Kumar and all the wonderful doctors on the panel and so many more have said this umpteen number of times. Lung Care Foundation was probably the first that started so many years ago, gave so much research and so many studies to show. And this itself is so startling and shocking and heartbreaking. As we all see the way we are saying, and we know that every child probably in Delhi is affected somehow or the other. But now, what do as parents? What is it more that we can do? I mean, we have the data is here. We are here. We are distressed. We are worried. We are absolutely concerned. But it's the policymakers and the politicians. After all, everybody is a parent or a grandparent, and I can't seem to understand. If we have a chance to give our children a decade of extra life with cleaning up the air, who wouldn't want to do it? So, it's like everyone thinks the same way, but when it comes to action, it's not happening because we are believing in smog towers, which are absolutely a farce, or we are, instead of implementing, waste management bylaws, we are concentrating on making waste-to-energy plants. Or, we don't, seem to worry about all the violations of the thermal power plants or clean energy. Man, there's just so many things that everyone knows. But the point is that it needs, because every second right now, even as you and I speak and all of us speak, our children are breathing and that toxicity is affecting them.
Right,
So,
like I said, this is a discussion, and NDTV, of course, has been reporting on this for years and years now, creating awareness around this. But we really need some more concrete steps to be taken. Dr. Vivek Nangia also with us. We'll just slip into a short break and return with more on this air emergency issue that we are discussing. Welcome back. We're discussing India's air emergency and two reports that with startling claims. One says air pollution is reducing our life expectancy by 9 years. Another compares children in Delhi and in less polluted areas and finds that more children in Delhi have asthma, have allergies, even obesity. Dr. Nangia, what would you say to parents who are worried right now, about their children? What can they do to protect them?
So, Gargi, this is a very well-known fact that children in Delhi especially are very prone to developing asthma. We've known that for years. In fact, now the numbers have only been increasing with the increasing levels of air pollution that the children are being exposed to. And this study from Lung Care Foundation is really an eye-opener. In fact, I would say it's like a wake-up call for us, at least to start our campaign against the air pollution for this autumn and this winter that is approaching now. And very soon we'll be encountering the crop burning and the stubble burning that will start harming our health. So I think the out and out message that will go to all the parents would be that they should not ignore their children's respiratory health. As this study has also shown that nearly 88% were not even aware that they have an underlying asthma, and only about 0.3% were those who were taking treatment for their asthma properly. So I think the message to them would be that children who are suffering with recurrent colds, coughs, breathing problems, chest tightness, they must consult their doctors, pediatricians, pulmonologists from time to time, be on proper treatment. They should actually be, their movement outside and outdoor physical activity should be guided by the air quality index on the particular days. Right. That's the only way we can protect them. And of course, if they can wear a mask, then there's nothing like it. They protect you from COVID as well as from air pollution.
Right now, wearing masks, fortunately, has become very commonplace, and that's something I think we'll be doing more in the months to come. Siddharth Virmani, again, coming back to your report, it talks about how the geographical coverage of air pollution is increasing. It also talks about how India, Pakistan, Bangladesh are all very affected by air pollution, and one just wonders how China did it. I know, they were in the same position as us, and since 2013, it said that they've reduced their particulate production by 29%.
Yeah, I think that, the reductions in air pollution, both in the US and China, that, they took 3 years into something called a war on pollution. And it was able to achieve large-scale reductions in air pollution. If these type of improvements in India are also sustained, then, as an average resident, we would probably also see a high life expectancy. But I think that part of this whole thing is government policies. Part of this is, new technologies. But I think one of the most important things which can make a real difference is, when the citizens start demanding the clean air. And I just heard somebody on this panel talk about, most of the parents are not even aware of the pollution issue. I think that that really is going to make the real difference when there is a demand from the citizens for clean air. And then when there is increased public participation in this whole environmental regulatory and action process.
And that has really increased in Delhi, I have to say, over the last couple of years. Dr. Kumar, what do you think, what do we need to demand of this government? And we have been demanding, of course, and what steps can they take to improve the, in this medical crisis, health crisis that we're seeing because of air pollution?
Gargi, I would 100% agree with what Mr. Virmani said, that unless it becomes a nationwide people's movement, and I would love to see the next parliament election actually fought on this issue, does your party commit to the fact that clean air is a human right, and you would do everything, not just lip service that most of them tend to do today, but concrete steps to achieve clean air in a certain time? Then only things will improve. But while we talk of Gargi, I want to convey one very important message.
Yes.
Now, as Dr. Nangia said, that we have known that asthma is present in higher numbers in Delhi. Our study has proved that it's startlingly high, 37% in boys and 20% in girls. While we'll continue to debate about methods to reduce air pollution, immediate need of the hour is to increase awareness about asthma amongst parents, amongst public, and particularly the stakeholders.
Right, no, absolutely. It was quite incredible to see in your study that you say a lot of people not even aware, the children aren't aware that they have these underlying conditions. And Bhavreen, you have your job cut out for you. Going ahead, the warrior moms will have to create a lot of noise, about air pollution. And of course, NDTV is there to constantly talk about it as well.
Gargi,
Yes.
if you can just give me 1 more minute. There is something I want to use this opportunity to suggest. We badly need an asthma policy for schools.
Okay.
Millions of children are going to school. When you have 33% incidence of asthma in children, many of them will have problems while they are in school, and their proper management will depend on the awareness and existence of a protocol. All Western countries have asthma policies in their schools. And I think time has come where, at least in Delhi, we immediately implement asthma policy across schools where there should be.
All right, that's a very important suggestion, and it's sad that we are in that situation, but we have been for many years. Thank you so much. I'm completely out of time, but thank you so much all for joining us on this program, and this is something we're going to be talking about more and more in the weeks to come. That's all we have time for. Thanks so much for watching. Goodbye.